Hi everyone! Thank you for joining our in-service today. Laugh, talk, connect, using humor and authenticity to strengthen the therapeutic relationship. As DPT students and future clinicians, we're taught a ton about biomechanics, pathology, and manual skills, but when we're actually in the room with the patient, none of that lands unless the person trusts us, feels safe with us, and believes we genuinely care about them. The therapeutic relationship is not just a nice extra, it's one of the strongest predictors of outcomes. When we think about humor in healthcare, people often imagine it as something informal or unprofessional. But the evidence tells a different story. Appropriate humor can reduce patient anxiety, decrease perceived threat, and help patients feel more engaged in their own care. Humor, even something as small as a light comment or a shared laugh, actually shifts the emotional tone of a session. It can lower stress hormones, increase endorphins, and even create a general sense of psychological safety. For patients who are nervous, in pain, or self-conscious, which might be most of the people we meet, that safe connection is absolutely essential. And then there's authenticity. Patients are incredibly good at sensing when we're being scripted or just going through the motions. Authenticity doesn't mean oversharing. It means being real, being present, and bringing your human self into the interaction. When you combine that authenticity with appropriately timed humor, you create a relationship where patients feel comfortable, respected, and willing to put in the effort that rehab requires. These are our objectives for this in-service. First, we'll look at how humor and small talk actually influence therapeutic rapport. Second, we'll walk through the research that supports these strategies because humor isn't just intuition. There's actually evidence behind its psychological and social effects. Third, we'll talk about how to apply humor ethically and effectively in the clinic, how to match humor to the patient's personality, cultural background, and comfort level. And finally, we'll explore boundaries. Humor can be an amazing tool, but it can also backfire. Here is a classic example of the kind of humor we're talking about. This joke is cheesy, it's harmless, and most importantly, it's patient-centered. You're not making fun of anyone, you're not poking at a sensitive topic, and you're not making a personal comment. Simple, lighthearted moments like this can break the ice, help a patient relax, and signal that the environment is friendly and safe. The key is that humor should serve the patient, not our ego, and not our need to be entertaining.
Okay, so this is the science behind the laughter. It will decrease cortisol and stress hormone while increasing endorphins. Endorphins are good for pain tolerance and could benefit our patients, especially when they're going through like chronic pain or they're recovering. Lastly, hopefully you're funny enough to create a bond with their patients because you know how they all say a laughter a day keeps a doctor away. Okay. So small talk goes a long way. Just ask Stephanie. She's a master at it. Now, mastering the art of small talk isn't for everyone, but it should be. This is a great tool to break the ice and hopefully gather information from our patients, especially when creating goals that are more personalized for them. Remember, small talk turns into big talk, so eventually just keep at it and don't quit. Okay, so this picture is from, I don't know if you guys seen the Parks and Rec, the Genuine episode. So I thought this was funny, just kind of threw it in there. It's really genuine equals trust. So all of this is for a purpose. A shared laugh can help create trust between yourself and your patients. These curveball of jokes can force both therapist and patient out of their scripted interactions, thus making the relationship more genuine. So don't become an addict like Stephanie to just getting a laugh, because it's supposed to serve the patient and not our egos.
Okay, on this slide, I want to highlight why humor isn't just something nice in patient care. It's actually evidence-based. First, humor enhances the therapeutic alliance. Research shows that when humor is used appropriately, patients experience less anxiety, feel more emotionally comfortable, and open up more. This allows us as PTs to build a rapport faster and communicate more effectively. Second, laughter builds trust through neurobiology. When someone's laugh, their body releases endorphins. This increases social bonding and even raise pain tolerance. So shared laughter literally creates a biology foundation for trust. And finally, authenticity and cultural sensitivity matter. Humor improves adherence only when it matches the patient's cultures, comfort level, and communication style. When the humor is authentic and appropriate, patients buy in more, participate better, and report higher overall satisfaction. This slide is about how humor can be powerful, but also how we have to use it carefully. We walk a fine line because every patient is different. What's funny to one patient might be inappropriate or uncomfortable to another. Humor has to be used with intention, not randomly. The key is to read the room, notice your patient's mood, culture, age, and openness. Humor should feel supportive, respectful, and never forced. The goal is to connect, not to entertain. If we keep the focus on the patient's comfort and boundaries, humor becomes a safe tool rather than a risk. This slide explains situations where humor can actually do more harm than good. Humor backfires when it breaks trust, when it minimizes the patient experience, or when it feels sarcastic, dismissive, or judgmental. Some patients may interpret humor as unprofessional or as if the therapist isn't taking their condition seriously. Also, humor around sensitive topics, pain, disability, trauma, culture, or appearance should be completely avoided. The safest approach is to let the patient lead. If they use humor, we can meet them where they are. But if they are stressed, emotional, or in pain, humor might not be appropriate. Knowing when not to use humor is just as important as knowing when to use it. Okay, on this slide, I want to quickly break down some simple ways we can practice and improve our use of humor in patient care. The first thing is like icebreakers. Start with something small, light comments, a smile, or quick observation. Icebreakers set the tone and help the patient relax without trying too hard. Shared laughter. When you and the patient laugh at the same thing, even for a second, it builds instant connection. Shared laughter increases trust and make the session feel more human. Story snippets. Short, harmless stories like a funny moment from your day can make you relatable. Keep it very brief and always appropriate. Humor timing. Timing is everything. Humor works only when the patient is comfortable and open. If they are in pain, stress, or emotional, hold the humor and focus on support. Reflective listening. This one is huge. When patients feel heard, they are more open to light humor. Reflecting their words show respect, and then humor can enhance, not replace, that trust. These are all small skills, but when we practice them consistently, they help us use humor naturally, safely, and in a way that strengthens the therapeutic relationship.
So, being able to make someone laugh and smile is usually reciprocal and releases endorphins for both people. This helps in building a bond with patients, but also helps the therapist in looking forward to seeing someone. It's like when you notice a patient on your schedule that you had a great time in therapy with them last time you saw them, and you get excited to see them again and look forward to that laughter you had once before. We continue growing our relationship with the patient. Working 40 plus hours a week can take a toll on someone, and being in the health industry, it's important that we take care of ourselves. The last thing we want to have is burnout, because that will directly affect our care and our lives. Having fun at work and holding our standards of ethics throughout is the foundation of creating a strong team. The better the morale of the team, the better the patient outcomes tend to be usually. Our goal is to treat the patient both in the mental and physical state. So in summary, our goal should not just be to get to the root cause of a patient's pain, but also create an environment where the patient can be themselves and have fun. We want to be a ray of sunshine on those cloudy days and be the ones to put a smile on our patients' faces. We want to be empathetic, compassionate, and respectful throughout the process. The key is to always act with high moral standards and stay ethical. There can be a fine line of going too far when it comes to being funny, but we have the ability and knowledge to know what it means to take it too far. We want to be well-rounded in our skill set of care and make sure that we are able to meet and exceed our patients' expectations of us. These are the references that we use throughout our PowerPoint. If there are any further questions or you just want to know more, please feel free to post a comment on the video and we will get back to you. Thank you so much for watching.